I feel like therapists don't understand that, and this is happening, it's actually getting worse. They believe that how you behave and what you do is who you are. So if you're a straight man and you have with a man, you're no longer straight. That it's based on behavior, not attraction.
Now, I want to circle back around to talk a little bit more about Imago, but I want to talk about it in the framework of working with LGBTQIA individuals and couples. So, does Imago shift when working with LGBTQIA couples or individuals, or is it the same process?
Same. And that's what I loved about it. In the 90s or in the 80s, when Harville Hendrix created this model, I was drawn to it because there was only his, I think Gottman, and really, I don't remember any other model that existed. And this wasn't gender based, it was love based. So it didn't matter what gender you were or who you fell in love with. And what I love about Imago is that it teaches, even if, let's say, and you're married to a woman, that doesn't mean the issues with your father aren't going to come out with this woman. It will if he was the more dominant parent that harmed you or negatively influenced you. So
Yeah.
really, it's exactly the same.
Yeah, yeah. And so it could be either parent. It's just the primary. It's not gender related.
It's not gender related. And the only thing I will say specific to gay and lesbian couples is the validation is hard. It's even harder for them because if I validate your experience, that's just how we're raised, then I have to invalidate my experience. So you're telling me I'm straight. Okay, I'm straight, but I'm not. That gets contaminated in the room when they're fighting over something, and getting them to say, you make sense to me from your point of view, because now they're like, wait a minute, my point of view matters too. It
Yeah.
does. We're just doing your partner first. We're going to get to you. And that can
Yeah.
be difficult because you were raised differently.
And now, what do clinicians often miss when working with sexual identity or gender identity?
So much actually with
So
sexual
much.
they
It's a whole
do. They do.
podcast.
And I used to be one of these people because we didn't have all these nuances. We didn't know enough. We just knew gay and straight. We didn't get bi. We didn't get asexual. Even though Kinsey, did you know this? Kinsey has an X factor in the 40s and the 50s for asexuals. It's called the X factor, people that were
Mm.
not sexual. And
Yeah.
we never addressed that. I feel like therapists don't understand that, and this is happening, it's actually getting worse. They believe that how you behave and what you do is who you are. So if you're a straight man and you have sex with a man, you're no longer straight. That it's based on behavior, not attraction, and not arousal and pleasure and identity and all the nuanced things that we do as sex therapists, we understand.
Yeah. Yeah. Now, I want to talk about clinical skills. What are the most important skills that a therapist needs to effectively facilitate Imago?
They have to know how to do the intentional dialogue, which is 101 of Imago, which is getting one person to be the sender and the receiver and teaching them that it's going to be one topic. They don't change to two different topics. It's one topic they both have to agree on. If they get flooded while they're doing this on either side, they can ask for a timeout. I can't hear you anymore, or I can't speak anymore because I'm overwhelmed. And that's fair to stop because otherwise you're trying to push for something and it's going to be useless.
Yeah.
And then they have to go, the center has to learn to talk in the same voice tone that you would ask somebody to pass the salt and pepper at a dinner table. And that's hard to do.
Mm.
Because
Yeah.
when you're talking to your partner and you're upset, you want to say, and then you da 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 da, and that your partner's now defensive. So they have a responsibility, one or two sentences, and the other partner has a responsibility in hearing them. What I hear you saying is, did I get it? Is there more? And sometimes I'll have them just talk about positive things so that they can get used to the whole communication style so that we then move to the negative.